Prisons are breeding grounds for tuberculosis, HIV and malaria, infectious diseases that weaken the immune system. Overcrowding, unsanitary conditions and inadequate screening and treatment mean that TB and malaria prevalence is far higher than in the wider community. Morbidity and mortality rates for all three diseases are also usually much higher behind bars. But in Uganda, 3 pilot projects have shown that significant progress can be made in reducing the spread of all 3 diseases in detention. After discussions between the Ugandan authorities and the International Committee of the Red Cross, the project to improve healthcare in Luzira, Fort Portal and Gulu prisons began in February 2008. The results have been striking. TB cure rates have soared, malaria cases have fallen, and HIV/AIDS mortality rates are lower than in the general population. On arrival, all patients are registered and immediately quarantined in an annex away from the rest of the population.
Our main focus will be on TB because we have found out that TB is killing a lot of people in prison, and we want you to stay healthy. You pass out the way you have come.
They're screened for tuberculosis, HIV/AIDS and malaria, as well as for other diseases.
Have you ever suffered from TB?
No.
Do you have cough?
Yes.
Their body mass index is calculated to see if they're the correct weight for their height.
Your height is 1.65. The BMI is 21.6.
They're tested for any respiratory problems. If they suspect TB, the patient undergoes further tests. Staff collect sputum from the TB suspects early in the morning. They directly observe the patients to make sure they don't give false samples, as their living conditions in detention are better. The samples are sealed to avoid contamination and taken for testing at the laboratory. If positive, the patient will be sent to a local hospital for radiography. Since 2009, mass annual TB screenings have been carried out, improving TB detection rates. The results from the TB tests are given to the patient within 24 hours, in line with international standards.
So now that we have found out what was disturbing you, you will take this drug for 8 months. TB is a curable disease.
Those who are positive immediately begin treatment. Patients are always directly observed, swallowing the pills. This prevents them from keeping the drugs, which cost up to $400 a course, and arranging for them to be sold on the open market. But most importantly, it ensures patients complete the treatment.
The risk of not continuing with the TB treatment is that you are at a risk of death. You are at a risk of developing multi-drug resistance TB, which is very expensive to manage in our country.
Everything is done to ensure the treatment is successful. Straight after diagnosis, patients are isolated in a special TB ward.
Makati wamechukua mimi kwa x-ray kwenda kupima mimi huko wakapata miko na TB, baada yake wakaleta mimi hapa kukuja kwa TB ward kukuja kupata dawa.
For the first 2 months during their infectious period, they don't leave the isolation area except for medical reasons or for family visits. Further sputum tests are taken at 2 and 5 months to check the patient is responding to treatment. Prisoners are also given a better diet to boost their immune systems.
We give them vegetables, we give them porridge, because we are told that TB drugs require the patients to eat a lot more than the normal person. So we give them bigger ration compared to the rest of the inmates.
Through screening, isolation and directly observing the patients, treatment success rates have soared.
From here, it's okay.
Rates have risen from 64.3% in 2009 to 73.8% in 2010, and in 2011 increased to 87.5%, surpassing the WHO recommended target of 85%. Mortality rates over the same period were extremely low, with only one patient a year dying from TB.
You are aware you are going to test for what? We are going to test for HIV. Have you ever heard of HIV/AIDS before?
Just like TB, HIV prevalence is much higher in prison than in the general population. New arrivals are offered voluntary HIV testing and follow-up care.
When we were brought here, we have been advised on HIV/AIDS. We could go for the HIV counseling and testing. And the services here provided freely, and we should take this chance because at the moment we walk out of this place, we might not have time.
If patients are HIV positive, they're at far greater risk of contracting TB and dying from it due to a weakened immune system. Likewise, if patients have TB and engage in unprotected sex, they're more prone to contracting HIV. Patients who test positive can be given antiretroviral drugs. The prison also encourages peer-to-peer counselling for those with HIV.
We have also put in place some of their fellow inmates whom we have trained, because we have their AIDS committee. So we engage those inmates to help monitor their fellow inmates closely, while the staff on duty have got a role to play in also monitoring to ensure that such persons get their drugs in time.
HIV/AIDS mortality rates have dropped from 0.081% of the population in 2009 to zero mortality in 2010 and 2011. With weakened immune systems, TB and HIV patients are particularly vulnerable to malaria. They also tend to suffer from more severe and frequent bouts of this mosquito-borne infectious disease. Prevention is the best cure. Wards are regularly sprayed and windows covered with meshing. Mosquito nets are given to female prisoners with children. Immediately a detainee shows symptoms, diagnostic tests are carried out at the prison laboratory. Results are known within hours, and if positive, the patient is put on a 5-day course of drugs. As a result of the preventative measures, the number of malaria cases has dropped by 71% between 2009 and 2011. During this period, no patients died from malaria. As well as improving treatment and mortality rates for TB, HIV and malaria, the pilot project also aimed at improving healthcare infrastructure.
I would say the Gulu Prison Laboratory is better than other laboratories within prison because we have the baseline equipment in place and we are able to do the baseline investigations necessary or required.
With the installation of a regular water supply and solar panels providing electricity, the laboratory is now operational around the clock. A database and an incinerator for waste management has also been provided. Gulu is now the referral regional health centre for all prisons in North Uganda. It also provides high-quality healthcare for the local population. On release from prison, a patient is referred to a nearby health facility where he can continue his treatment. Mobilising local health providers and national healthcare services was a key strategic aim of the pilot prison project. Godfrey was in Gulu prison for 6 months. He had TB and was diagnosed HIV positive. Since leaving Gulu, he's been collecting his medicine at Bobi Health Centre, near to where he lives.
Kuhusu ugonjwa wangu nataka nini Gulu Central Prison. Pale nasema mtu yako kama miko nyumbani anaamka asubuhi anamwambia kama mmesahau dawa saa yake anasema meza dawa.
Health centre staff work with community-based treatment supporters who visit patients in their homes to check they're taking their medicine and attending appointments.
As we have trained them, we got their contact. So we do make phone calls with them. In case we get a patient, we call them that such a patient is in your area or is in your village. If you know such a person, you make contact. In case the patient defaults, also we call them.
HIV and TB. In your collection, the procedure you have to take is
In 2012, the ICRC handed over the 3 pilot projects in Gulu, Luzira and Fort Portal to the Ugandan authorities. Across all 3 projects, treatment success rates for TB averaged 87.1%, exceeding targets set by the Ugandan Health Ministry and by the WHO for successful TB treatment. The mortality rate for HIV/AIDS in these 3 prisons remained relatively stable, while the incidence rates of malaria dropped by 76% between 2009 and 2011. Buoyed by the results of the pilot projects, the authorities are keen to replicate the best practices across Uganda.
The second approach was to mobilize all the health services providers.
We are starting with the regional prison health units, which are 14. We shall scale up, but the target is to eventually have all the best practices institutionalized in the 230 prison units across the country.
Some of the prison officers in the pilot projects are already beginning to transfer their knowledge to new prisons. One convert is Alex Oloka, former officer in charge at Gulu prison.
What we have gone through in the last 5 years is a great transformation from a system that is rudimentary to something much modern that has served for the benefit of the inmates, staff and the neighbouring community who actually access services, because the quality of services they do get from the prisons is much better than even an outside health facility.
These services must be offered. And I'm very proud of this capacity which has been offered to us.
The achievements are considered a model for Uganda and neighbouring countries.
And we are going to try and replicate it in other prisons.
I am passionate on all the ingredients of this project because this is a revolution in the provision of healthcare services in a prison setting.
The Uganda Healthcare in Prison pilot project owed its success to political commitment from the authorities in Uganda to lowering TB, HIV and malaria morbidity and mortality rates in prisons. Cooperation between the Ministries of Health, Justice and Interior. Renovated prison health centres and specialised training for staff. Follow-up care due to mobilisation of local health service providers and community-based treatment supporters. The project has set an example in the region of how to treat TB, HIV and malaria in detention. It has also saved countless lives by giving sick prisoners hope for the future.